Hi, I'm Therese Swenson, and I'm here at the Siskiyou Media Council. This is Mountain Community Television, MCTV 15, and also Wairika Television, YCTV 4. My show in Mount Shasta has always been about town, and I've also done a show called Places to Go. But today I'm just here to talk to you. This show is about COVID-19. So this is called the new normal today because really we all have to accept that we need to prepare ourselves, that everything's going to change, whether it was our food sources, our economy, our jobs. This COVID-19 has traveled across the country. It keeps having hot spots. And today I just wanted to have an update. You know, in February, I was up at the TV studio in Ashland, and I did an update at the end of February saying, this is here. I'm not trying to frighten you. This isn't about fear. It's about consciousness. And it's what we can all do to protect not only ourselves and our family, but also our neighbors and our coworkers and those that we come in contact with in the service industry that give us our food or our gas or whatever it is. We need to wear a mask, and it is important. And whenever we're within 6 feet of somebody, we need to have to be conscious of that. So that's one of the new normal things I want to remind you. The reality is 90-something% of the people will have the virus, have minor symptoms, and survive. So I'm not asking you to sound the alarm to cause fear and anxiety. I'm trying to make all of us conscious that this is going to happen for a while. This isn't just over. You know, this part of the county, we were all so very careful. Everybody following the rules, hunkering down, staying home. For about 6 to 8 weeks, people were very, very careful. And because of that, we were able to control the spread in Siskiyou County. So our numbers are down. Like, if you look at Siskiyou County, we don't have that many tests being done. We don't have that many cases. We don't have people dying of it. But now with the state of California, the highway opening up, Siskiyou County opening up, we will have more tourists coming from areas that have had a higher incident in their community. Now, I know that you're finding that when you go somewhere, they want to take your temperature. They're asking us all to wear these face masks. And also, we're being asked to use Purell for the same amount of time we use soap and water. And also, the thing I want to remind you about these wipes, what's important about these is they're not paper. They have some sort of plastic in them, so they cannot go in the sewer system. This is so important that I reinforce this and tell you, don't ever throw it in the toilet and flush it, because it doesn't dissolve. And the sewer systems, they go through different turns and different pumps, and the product in them needs to dissolve. So they're finding problems in sewer systems because people think they can flush this away. I want to remind you to just use these because they don't break down. They're kind of another plastic. But use them to wipe off surfaces. It's important when you come home that you're conscious, maybe even to start taking off your shoes at the front door. We don't know about viral shedding. Viral shedding is what it's called when this virus gives off, whether you inhale it or you touch something and put it in your eyes or your nose or your mouth. We're not really sure. We're still learning, but it is so important every day, multiple times a day, to wash your hands. And that will really help. The doctors that work in the emergency rooms say that if they wear the protective clothing and the masks, they're finding that the people that use washing of their hands repeatedly, they're not catching the virus. So we are in some ways able to control the spread. The most important part about controlling the spread is that the hospitals are not overburdened with special intensive care unit care that's required. This disease affects the lungs primarily. That's where they've found people all of a sudden, I can't breathe. Takes on two different meanings. People go to the hospital because they're short of breath. And there are medicines that can help the lungs dilate and accept more air and oxygen, which gets oxygen to your system. But I want to read this letter, or parts of it. I want to read a few parts of this letter that was in the paper. I've been collecting articles about COVID, and I did a little update in February in Ashland at the Southern Oregon University TV show up there I do called Tough Times, and these are tough times. And that show, then I came down here to Siskiyou County and I did a show at the Alvarado studio, and it was a COVID update, and that was in March. And then I did another little bit in April and May. This is my June COVID update. I'm not sure if they've all been on at times where you would have caught them. But I'd like to remind people that we haven't faced a public health threat like this in over 100 years. Worldwide, the daily increases in confirmed cases and deaths. It's clear to the public health experts that a pandemic is gaining momentum, and it's not soon subsiding as we were hoping. If we do not act quickly and collaboratively, the doctors are asking all of us to be able to save lives. Now, it doesn't do any good to soften the reality of what we're confronting. We must prepare ourselves for loss. Normal routines, services, economic security, and tragically, we're going to lose people that we love. The only question is how great the losses will be, and we can all make a difference. This outcome is our shared commitment. We need to take individual responsibility and also civic responsibility to adhere to the preventative measures. And it's most important if we can just try to stay home as this virus rolls across the country and through our communities, if we can just spread out the sharing of this virus till we all have some natural immunity. There's a lot of people that talk about herd immunity, and if a large percentage of people in a city or a state have the antibodies, researchers may determine that there's enough herd immunity to protect those that haven't contracted the virus. But I want to remind you that the people that are at risk are people that have congestive heart failure, and that affects the blood and the oxygen getting to your lungs. So if you have bronchitis or pneumonia, or you're a person that has asthma, you may have increased lack of immunity to protect you against this disease. Now, what's important about treatment is that we've tried to use the ventilators, but they find that they use it as a last resort, but people don't really have good response from the ventilators. It can keep them alive while they're trying to treat this new affliction to the lung. It actually kind of creates fibers or does something that takes up lung capacity. Even after people recover from this disease, it turns out their capacity of their lung is reduced by 20 or 30%. So that means that breathing, they're getting less oxygen. One doctor that was interviewed, she was 6 to 8 weeks after recovering, and people do recover. So we're not afraid that some people won't recover. But when they have that reduced lung capacity, she said she couldn't walk two blocks, that she wasn't out of breath. So we have to keep in mind that wearing a mask protects you from getting that viral shedding that's in the room air, but it also protects other people if you are asymptomatic. And the concern here is, one of the things I saw that was an interesting interview was when this spokesperson broke down and said, you don't know if you're asymptomatic and the person you're talking to is going to take home that virus to an elder in their house. Or he suggested a child that might be, or another family member that's getting chemotherapy. if you're getting chemotherapy, it reduces your immune response because you're kind of distracting that immune response while you kill the cancer. So we all need to get time in the sun to increase our vitamin D and maybe take extra vitamin D because that helps your immune response. So what else I want to remind you about this letter? We need to slow the spread of this virus. Certain people, like essential workers who must work, we thank them for their dedication. Your staying home keeps them safe. Staying home will protect you and everyone who would otherwise come in contact. If everyone stays home as much as possible. Now we know that we're trying to get people back into the economy for shopping and getting the things that you need to keep your family at home. You don't need to take the whole family to the market. One of the things I notice sometimes, like they've made my market one way each row, and I forget sometimes, but if one person is doing the shopping with a list, that's one person in the aisle. But if a whole family is coming down the aisle, that's the reason they've tried to create this traffic flow. I haven't quite caught on. I found myself going the wrong way. But they're trying to keep people separate as much as possible. One of the treatments they're doing in the hospital I saw, they're like rolling people over every 3 hours or something onto a side. And that way they don't collect water in their lungs or something. But anyway, so that was just one of the things I wanted to mention to you, is that the doctors are asking us, because they work on the front line and they see this, if we can do everything we can. So now the tests that could reopen the country that we're trying to do, we're trying to find out people that are healthy, people that have no antibodies, but there are healthy people with antibodies. We want to find out who's contagious. We want to find out if the virus is, they're kind of doing testing to see if there's a person that is contagious, how it's spread in the room, like how it travels in the air, or they're testing an antibody, of course, means that your body is fighting off the immunization, and they're hoping that if enough people get it, the reason tests are important, and I get frustrated that we're not doing more testing, is if we did more testing and we knew who had the antibody, and they're maybe 8, 10, 12 weeks away, they have a lot of antibodies, we might be able to use that. We can draw their blood and remove that serum that has the antibodies, and we can treat people with it, because it takes a very sick person and it gives them some additional fighting antibodies. So it is important that we find out who's had it. It's important that we do testing. I was discouraged to hear the president say, if we don't test, the numbers don't go up. Well, the numbers may not go up, but people are still dying. We've lost 120,000 people so in 4 or 5 months, I mean, we're losing more than 10,000 people a month. And that's just because this is so extremely contagious, and we haven't built up enough antibodies, and we don't have a treatment that so far we've tried different kinds of treatments. We're having positive results with something I think was called Relevant or something. They're trying to give people relief and increase their breathing, and so that we can keep the oxygen in the body. Anyway, so the testing that's being done is to determine if people have had it, haven't had it, whether or not they have antibodies. So during this time that people are really being asked to stay home, and we've all kind of had, it's been humbling because all people, rich and poor, have been confined to their home and have had to find things to do to make their life have some sort of routine, have shared responsibility in the house, shared accessibility to the remote control. Also the fact that when you're confined, no matter how small a space, you're confined with a way to exercise, whether you exercise in place. We've seen some great videos of people that do things together. They have fun with music. We really need to not just sit curled up in a chair with a game or with a TV clicker. We need to stand up. We need our body to get exercise. We need for everything inside to work properly, we have to jumble it around. So it's so important to get out and walk. Now, this picture shows people a little close together, but if you're a family and this is your pod, you know, we've all had X amount of people that we allow to be in our circle. And we could walk with them or we can have a meal with them. And because all of us are being careful, we're not introducing new viral shedding into our group. So anyway, I do want to remind you that vitamin D does help improve your immune system. And one of the things walking does is it gets you outside in the sun where you're collecting a little bit of sun. Dr. Parker told me it was okay to get in the sun 20 to 30 minutes a day. And I did see a skin dermatologist and asked her, is it okay if I spend time in the sun? Because I don't like to use sunscreen. And she said sunscreen is to keep people from burning. So if you're only doing 10, 20 minutes a day, you're getting the amount of vitamin D you need and you're not going to burn. So you don't have to worry. But if you're going to be out in the sun working in your garden and you can burn your skin, that's the danger that comes with skin cancer. So anyway, some of the other things I want to remind you is that this being apart doesn't mean we're not in touch. We still have Facebook, FaceTime, telephone calls, texting, emails, shared, social media, which brings up a really important thing I'd like to remind you. I have a little note here to remind myself that we are living in a technical world. And I like to remind everybody that you need to save data. If you're now working from your home, you need to, it's very important if you're working from your home, make sure that you have privacy protections. I'm sure your job suggested this too. Make sure you have privacy protection. But we are living in a technical world where people really do, you're walking in front of cameras and where did I have that written down to remind you? That everywhere you go, there's cameras. We're like totally being watched and we're like being tracked with our GPS phone. And this matters. You need to remember that everything you say and do can be recorded. And but it also reminds me that a lot of us, we have a cell phone that we depend on with our phone numbers for, you know, family members or work or important, the pharmacy or whatever it is you need to do on a regular basis. I know that we've all had the experience where we've accidentally gotten it wet or the picture is broken so we can't access data. So I want to remind you, save data, make a list. There's important phone numbers on there that you need to write down somewhere so that when that phone is disabled or damaged, pictures, it's so important. I know people in the old days, we had photographs, we went through photograph albums. Now everything's digital, but you can lose that. Make sure you store that somewhere else. And not everybody wants to pay for the cloud and store lots of pictures, but you can have a little jump drive. Just think about, you can lose all that from your phone. So right now, this time of the year, we give out phone books. The newspaper and the county produces a phone book. And in that phone book, there's actually lots of wonderful things. Last year at the county fair, I like to show people. And I said, take this phone book with a felt marker and write your mother's phone number, your work phone number. Just write it big in there. You don't have to use the phone book all the time to access numbers because nowadays you can find things on the web. But use that phone book to store those 5 or 6 important phone numbers, so that you don't have to wait for people to call to find their phone number again. But also in the phone book, there has the front pages. I want to tell you, they have maps of all the city. They have all the events that are coming up in the county. They have all your local important phone numbers like your police department, your fire department, your hospital numbers. There's a lot of information in that phone book that is not related to stored in the web. You don't have to search it. It's right there in 2 seconds. You can find it. So make a list of important numbers and put it in there because then you can find it. It's in that old phone book they give me every year. But people that think they don't need that phone book, I think you ought to keep it for a few weeks and just make sure that it doesn't have a use for you. Okay, and don't forget to save your pictures. I wanted to remind you about that. So during this shutdown, they talk about ways to calm anxiety during this shutdown. And one of the things that's really important is a lot of the people out of 120,000 people, how many of those people do you think had a will or a trust or even thought about who to sign the pink slip over to? This is really important. If there's a chance that you're getting sick or you get sick, once you go to the hospital, your family can't come see you. Time's up. It's so important for all of us to have made a decision about our car, our home, our, the cuckoo clock, whatever it is that you want to stay in the family, you need to put that in writing and make a commitment now, because we don't know who might get this COVID virus and go to the hospital and has not completed their paperwork. It occurred to me, it's time for everybody, even if you just write down your wishes and have 2 friends sign it. Of course, you can go online and get a will or a trust and do all the paperwork. But most important, if you can just make sure, and I said this before, if you take your sister to the doctor all the time and all of a sudden you have to go to the hospital with COVID, sign over that pink slip to your sister so she can have your car if you don't come home. Think about it. 120,000 people. How many people is the government going to get a probate fee from? Let's not give money to the government that way. Let's keep money in the families. I think a will and a trust has to be done, whether or not you just sit down and write it up and make sure everybody gets a copy. It's so important that when somebody's going to die, their wishes are respected. Okay, so now what else? I want to talk to you about really quick, because my time is running out. I'm running short, and I want to make sure I covered this COVID. We've got 120,000 people right now that have the virus. And we have, that have died from the virus. So it's come across the country, and every time they have a large group, they see an outbreak. And that's fine if the hospital has capacity. But in these smaller communities like we are, we don't have the capacity. So we still need to respect that stay-at-home request. We still need to, if you don't have to go out as a family. Now, again, if you're going to go out as a family, take a picnic lunch, go somewhere, spread out a blanket, keep your family together, but don't socialize. It's not a time to share the virus. We need to give 6 months or more to the second run of this, to where we feel like we've developed some immunities. And most important is, if you are at risk, don't go out and put yourself in a socializing. Okay, so they talk to you about a ways to walk and keep distance. You need to wear a mask if you're going to pass somebody. What not to do is to talk to people. Don't talk on your phone when you're out. When you yell and holler, it spreads it a little farther. There was one great depiction about how it kind of spills out when you're talking. We all kind of put a little moisture into the air, but it can go 6 feet. That's the reason they've established this. Your spittle can get into the air for 6 feet, and that's why it's so important. And it does start with a loss of smell, so think about that. If you're not able to taste something, John, my tech, said he wasn't sure if he wasn't tasting something, so he made a chocolate coffee, and he could taste that good, so he knew he was okay. Anyway, diabetes, obesity, other underlying conditions make you at risk. So you may want to stay inside and stay protected. Ventilators are not being used as much because they're trying these new medicines. Stay safe if you want to go to the beach or the pool. Make sure that all of your own stuff you've washed, and you keep and use your own stuff. That's the important part. Each person uses their own blankets and towels and goggles and balls and those kind of things. They're swimming in chlorine, so that's probably okay. The USA Today had regular things. They even told people, here's how to cut your hair. In my next show, I want to talk to you about the Siskiyou County has emergency preparedness, and that's really about fire. And that's going to be the next thing. We've had the coronavirus. We've had the people lose their jobs. We've had the stock market crash. And now we have to realize that summer's coming and temperatures are up. And even though they may have a burn day, we're starting to be dangerous for forest fires. In this area where I live, which is Northern California, we've experienced some horrific fires in Southern Oregon. And so in my next show, I want to talk to you about not only being careful for coronavirus, but we need to be prepared for the next crisis that we all can be responsible to reduce danger. So anyway, thanks for joining me. I'm at the Alvarado studio. We have a new TV studio in Weed, California. And we have TV shows that run in Wairika, in Channel 4 on the cable, and at the cable here. But I believe we're also on the web. So you can look up Siskiyou Media Council, or you can look up MC, Mountain Community Television, MCTV, and that's Channel 15. And the web will help you find it. Now in Oregon, that's Southern Oregon University, that's Rogue Valley Television, where I have a show up there. And that's RVTV. Anyway, thanks for visiting me. And the thing that I need to remind everybody is every day's a new day. Accept the things you're powerless about, because there's so many things we can't control. And just accept the things you're powerless about, and then do what you can to make each day better. And make sure that we're all being conscious of our neighbors, our friends, our family, and we're checking in with each other. Because just because we're being careful and isolating doesn't mean we're not in touch. And you know what? In the old days, people wrote letters, and they wrote letters in a way that told a story. People still go to their mailbox. Think about sending somebody a postcard. That's one thing I've realized with this virus. Less people will be flying. People will be driving across country, and they'll be camping and families together again. And so we'll maybe have all those fun postcards that had each state on it. So anyway, think of ways you can get exercise and get out and be safe. But let's keep from spreading this as much as we can. Thanks for joining me. I'll see you next time. Therese Swenson, and that is Siskiyou Media Council in Weed, California. Thank you.